And I'm going to ask you to clap in front of your face whenever you're ready. Perfect. So, Alex, whenever you're ready, get started.
Great. So tell me your name and your position at Pearly Whites.
Sure. My name is Sal Napoli. I'm a physician and a dentist, and I'm an oral and maxillofacial surgeon.
Great. So tell me, where are you from?
Well, originally I'm from Brooklyn, but I've lived more years in New Jersey than any other location.
And why did you decide to study dentistry, pursue that profession?
Well, I went to dental school intending to be an orthodontist. I went to Columbia University, and at Columbia my orthodontic exposure was somewhat limited, but at Columbia the first 2 years of school, the dental class and the medical class are combined, so I became a little more interested in the juicier end of things, I guess you could say, in surgery. And from dental school I went on to anesthesia. I had certification in anesthesia, and then oral and maxillofacial surgery in medical school, and then general surgery.
Great. And what attracted you to surgery, or what's interesting about it?
Surgery?
Yeah.
Well, I like healing people. I like taking care of people who have injuries. I certainly don't wish that upon them, but taking care of them and doing a good job is always very rewarding.
Great. So tell me a little bit about Pearly Whites. Can you describe it to someone that's never been here or even worked here?
Sure. Well, an important thing is this office is very family oriented, and they care. The administration cares very much for its staff, and that's reflected not only in the staff's morale, but in the care they provide for their patients. It's also a multi-specialty practice, so where people have varying expertise, that's expressed, and the patient is provided with expert care.
Great. Can you tell me an example of how you think patients were treated well, or they had a good experience in the past? Maybe some examples that you've seen so far?
Well, here at Pearly Whites, one of my main functions is, for example, the removal of teeth. And when I can get a tooth out, which is an unfortunate occurrence for the patient, means somebody fell somewhere along the line. If I could do that and they did not even know that I completed the task, they're still waiting for me to get started, and I'm telling them that they're done. That's usually a very rewarding thing. It's not uncommon for a child sometimes to come in and they have an unusual confluence or unusual problem with their eruption of their teeth, which requires a surgical intervention in addition to the orthodontics, and that's something that we could help them with on site without referring them to this office and that office.
Great. And then from the patient's perspective, can you tell me a little bit more why they should choose to come to Pearly Whites?
Well, in large part, this is, as I said, it's a family-oriented practice. It's a fun place for children to be, and I think parents appreciate the expertise that we can provide them at various levels and with various specialties.
Wonderful. Do you have any memorable experiences with patients that you could talk about? Either you don't have to mention them by name or anything like that, describe it, but just maybe talk in general about any memorable experiences that you've had. You can think about it for a while.
I really can't.
No.
I can't think of anything.
All right.
You have to.
Can you describe Pearly Whites and just tell me a few words or adjectives to describe it?
Competent, happy. The morale here is wonderful. The assistants are all experienced, bright. It's a pleasure to work here. The administration maintains the facility and the equipment and the techniques at cutting edge.
Wonderful. And so tell me a little bit more about facilities. What kind of facilities are accessible to children here?
I believe that there is a playroom for them to enjoy. There are, I think, internet facilities for them, and just the motif, the color scheme, the layout is just very pleasant, very disarming, not frightening. There isn't an office smell. It's just a nice, fun place to be.
Great. And in terms of how the children are treated here, what makes it different from other offices, or how do they make it easier on the children and parents?
Well, children have varying levels of anxiety, and there are really no children that can't be managed with some TLC. And where those patients might need a little more, nitrous oxide is available, and if a little more relaxation is necessary, we'll even have somebody come in who can provide that in an expert fashion and make the child and the parent comfortable while the work's being done on the child.
Great. And so we obviously have a new remodeled offices. In terms of adults that come in, what kind of facilities are available to them? Maybe you could talk a little bit about there's massage chairs, there's even wet towels are given to patients after their treatment. So can you talk a little bit about that overall experience for adults specifically?
Well, obviously coming into the dental office it's going to be a somewhat anxiety-evoking experience, and to whatever we can do to put a patient at ease, we do.